Amanda Mendes. I'm going to be recording the inserting of a Foley catheter and removal for New England NEIT Nursing. First, what I'm going to do is I'm going to go introduce myself to my patient, provide privacy, and we will continue from there. Hi, good morning. My name is Amanda. I am going to be your nurse today. Could I just verify your name and your date of birth? Perfect. That's great, Mrs. Smith. Today we're going to be inserting a Foley catheter for you today. What we're going to do is we're going to insert the Foley catheter, get some urine out, and then we'll leave it in for a few days as per the doctor's orders. First, we're going to take your bedding down. Before we get started, Mrs. Smith, do you have any allergies to any iodine, latex? Perfect. So we're just going to continue. Lift up your Johnny a little bit. I do have to expose you, and I apologize. We're going to open up your legs. Perfect. Now at this time I'm going to perform hand hygiene. I'm going to wash my hands. Now I'm going to remove my sterile Foley kit, discarding anything over here that I don't need. When I open my kit, I want to make sure that I open everything, the first flap away from me. And the sides, and pull this down towards me. Moving my sterile field, keeping in mind that I do have a 1-inch border that is not sterile. First and foremost, I'm going to take this piece out because I don't need it. I'm going to now don sterile gloves. Once again, being careful not to touch the edges. My first step is I'm going to put this glove on using my putting it on my non-dominant hand, applying the gloves, making sure that with this non-sterile hand, I only touch the inside. With my sterile glove now, I can grab this glove and place it on. Careful to leave my thumb away. Now that I have this sterile glove on, I can reach inside and pull this down as well. I'm just going to leave that there because it's not in the way. Maintaining sterile technique by keeping my hands above my waist. My first step is I'm going to take my drape, open it up, and place it in between my patient's legs. Being careful not to touch anything in the meantime. This is a fenestrated drape I do not need because my patient is a female. I'm going to just discard anything that I don't need. Move my packaging, once again keeping in mind of the 1-inch sterile border. I'm going to remove my packaging from the top of my catheter, dropping it, taking my lube, placing it on the top, taking my syringe, removing the top, placing it in the discard container, and placing it on my tubing. Now I'm going to take everything in the box, just grab it by the ends, placing it in between my patient's legs. Now what I'm going to do is I'm going to clean the patient. I'm going to separate, clean one side, front to back, discarding, making sure not to turn my back towards my sterile field. Then the other side, front to back, discard. Middle, front to back, discard. And because my kit came with multiple, I'm going to do another round. Front to back, discard. Front to back, discard. Front to back, discard. discard this. Now removing my catheter from the loop, being careful not to touch, maintaining sterile technique by not getting too close to the patients. I'm going to insert the catheter until I see urine. Once I see urine, I'm going to insert another 2 inches and stop. I'm going to release. I'm going to inflate the balloon inside, 5 milliliters, and remove my sterile water and discard. Now I'm going to tug to make sure the balloon is in place. Taking my catheter, taping it to my patient's leg, dropping this to the ground, hanging it on the bed. We're going to take this, place it over there. We're going to take the tag that we previously took and put it on the patient's bag for the patient identification. Then we would cover the patient back up, wash our hands, take our sterile gloves off, cover the patient back up. Now what we're going to do is now we have doctor's orders to remove the Foley catheter. So we would go back into the room. Hi, Mrs. Smith. My name is Amanda. I'm going to be your nurse today. I have doctor's orders to remove your Foley catheter. We would do the same steps. We would uncover the patient, position our patient, wash our hands, don clean gloves, because this is just a clean technique. Make sure our bag is completely empty before we remove it. Taking our syringe, applying it to the valve, removing all of the water, the sterile water in the balloon, instructing our patient to take deep breaths as we remove slowly. Once this is removed, we can take this and throw it right in our trash. Take our gloves, put them in the trash as well. Position our patient to a more comfortable position. Lowering her Johnny, covering her, lowering the bed for safety precautions. Mrs. Smith, we are all set now that we've removed the catheter. If you feel any pain, burning, or any other issues, please feel free to contact me. You can hit the nurse button and I will be right here. Thank you and have a wonderful day.